Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth, and we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Kusumamala with us. She has been with us previously as well, discussing about psychiatry, her branch in depth, and now she's here for a very special topic, understanding about taking care of yourself mentally and emotionally in these difficult times. She is a leading practitioner there in Mumbai with more than 5 years of experience. She has been doing really well till now, and currently she's helping so many doctors as well as people in helping them to get over all the emotional as well as mental problems and to stay happy and healthy. So, welcome, Doctor, to the platform. It's really nice to have you here again.
Hi, Dr. Aishi. Thanks for having me.
Yes,
It's a pleasure.
thank you so much. So, if, for our new viewers, if you can again mention how did you pick up psychiatry and, how has your journey been till now, it would be great.
Well, the journey, it's been 6 years since I joined psychiatry. It's been a very enriching experience, and I have always been a people's person,
Hmm.
so I have really enjoyed so far.
Yes, yes. I can completely vouch for that. So, so now, understanding with the current pandemic and
Mhm,
everything going on.
mhm.
So, and doctors are one of those segment of the society who has been dealing with it, handling it, and managing everything around. So, do you think that mental health for doctors is also one major thing in the society that is not being spoken about? What is your view on that?
Well, about mental health of doctors not being spoken about, there's a pretense in society that doctors never fall ill.
Hmm.
अरे
Yes.
तुम तो डॉक्टर हो तुमको क्या हो सकता है this you often get to hear this you're a doctor you must relate with this
Yes. Yes. Yes.
so and even doctors we are very altruistic. We put the needs of our patients and our work above all.
Correct.
Work always working for a greater goal. We During that our physical as well as mental health usually tends to take a back seat
Hmm.
as it is. Mental health profession, medical professionals are very stressed.
Hmm.
Upon that, in uh, the time of this pandemic, it's like flogging a dead horse or flogging a tired horse. Everybody is tired. Everybody is exhausted.
Correct. 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 I completely agree. Especially
Hmm,
pandemic has been going for so long now that
I know.
everybody is
Hmm,
exhausted right now.
hmm.
And so, do you see cases of doctors, on an everyday basis? How is it? How has it been till now? Have you
Okay.
been dealing with doctors?
Okay. So there is something called burnout syndrome. It's become increasingly common.
Okay.
Okay, where the doctors are emotionally exhausted. They're not able to focus, and their work performance is not as good as before.
Hmm.
So this has been increasingly common. Along with this, it is very common for me to see anxiety and depression symptoms, sleep deprivation, and some emotional issues. Some of them also have resorted to substance use.
Okay. Okay.
Uh,
Okay. Hmm.
so these things are being common these days. So these are the ways how they're trying to cope up.
Hmm. 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 I can completely. So
Mm,
with so now when you mention with so many things,
mm,
happening and they themselves able to coping up, what are what are your suggestions for all those doctors, especially
mm.
resident doctors? I believe those are the doctors who are mostly affected at this point in time. what
Right.
is what are some simple ways that you
Mm,
will suggest to them to get
mhm,
over this, to just take care
mm.
of themselves in short?
Okay. Take care of themselves. Self-care. I cannot stress this enough. Simple things like eating clean, a good nutrition can do wonders to your mental health as well as physical health. Eating clean and sleeping regular sleep patterns.
Hmm.
All right. While working, taking break. Finding a respite. 5 minutes, 10 minutes of respite in their work schedule also can help. And finally, we should stop glorifying working overtime. There are people who get appreciated, applauded a lot for working too much. Finally, you cannot pour from an empty glass.
Yes.
We must realize that we have to take some time for ourselves. And even when you're working, it's better to keep the channels of communication open. Have a work buddy whom you can speak to, approach at times of need. And at home, when you're not working, um, pick up a hobby, or rekindling previous hobbies can help.
Hmm, 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 hmm,
And another thing, we are constantly logged on to news.
hmm,
It can be very stressful,
hmm.
right? So it is very important that we uh, acquire news only at specified period of time. Uh, Preferably avoid watching news or reading news in the morning or just before going to bed.
Hmm. Okay, okay. These are some very, very helpful and important points. I can completely agree to these. So now, apart from this,
Mm,
when you this is something that to imbibe on an everyday basis,
mm,
for their mental health. As you
mm,
mentioned, there are emotional, stressed out people,
mm,
busy
mm,
workers as well, especially
mm,
now, and
mm,
especially in this wave, there are a lot of loved ones who have
mm.
they have lost their loved ones while taking care of their patients as well.
Right.
So how is it, what do you suggest for these kind of people? How can they take care of themselves during this time? How to take care of oneself
Mm,
during the
mm,
emotional stress is
mm,
something I want to ask.
mm, 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 mm. Right. As doctors, we have to take very difficult decisions, like when to put a patient on ventilator, or even breaking a bad news. So we have to be very careful. If you have to, support a patient or their relative, we have to be sensitive about their emotions as well. And we need to be clear about whatever information we are going to give them, understand, empathize them.
Mm,
And it can, the death of your patient can also take a toll on
yourself.
your mental health. So you have to acknowledge that what has happened is, sometimes beyond our control, most of the times now. So we have to acknowledge that. And if you feel a kind of, if you feel any emotions, it is okay,
Mm,
as long as you are able to handle it. It is okay. Allow yourself to feel sad. Allow yourself to feel depressed.
mm,
All right.
mm,
And when you are grieving,
mm,
uh, again, you have to acknowledge the fact that there is a loss. And talking about the bereaved person,
mm,
talking nice things, remembering, okay, reminiscing about the all the good memories can also help.
mm.
And everybody goes through grief in a different way.
Correct.
So you don't have to judge. You don't have to. Uh, you don't have to push yourself. Then I'm not able to do it. I have to start working soon. Okay, it's okay. You can take your time. You can take a break.
Mm.
And in case you're not able to handle it, it is important to seek help.
Okay. Okay. Mm.
Mm,
So now, when you mean that you are not able to handle it,
mm,
so how can a person understand that you are not able to? Because then when you tell that person to take a break, there are
mm,
times that you pass some of the days, just
mm,
you're like, okay,
mm,
I'm able to handle it.
mm,
So what is the time that you will suggest the doctors or any of your patient that what is the time
mm.
that they feel that you should go for help? What is your suggestion to that?
Um, Sleep deprivation, changes in sleep and eating patterns, first of all, and incessant crying and uncontrollable emotions. And if you're not able to cut down on substances like cigarette or alcohol, and any odd behavior or bizarre behavior,
Hmm.
all these are, I think, red flag signs
Hmm. Hmm.
of deteriorating mental health. Along with that, significant occupational impairment
Hmm. Hmm.
also is an indicator that you need professional help.
Hmm. Hmm. Correct, correct. So these are really important points.
While working, it is important to check on yourself. Am I sleeping well? Am I eating well? While you're checking on your patients, it is also important to check on yourself too.
And this is something I believe most of the doctors lack. They just don't take care of themselves.
Yeah.
So, when I mentioned that doctors actually don't take care of themselves, uh, how, and you have mentioned that you have to take care of themselves, of
Mm,
taking care of small small things. What,
mm,
if you can just tell some 3 4 points that they find it alarming
mm,
for the doctors, especially for doctors, what are the signs
mm,
that you when you see in yourself and you are alarmed and you should take
mm,
care, you should just stop and take care of yourself, because
mm.
if you can suggest some of them.
Okay. There are some signs of burnout.
Okay.
Like I mentioned, you constantly feel exhausted, not able to focus. Your performance is not up to the mark. You
Hmm.
feel hopeless. You don't feel motivated enough to work.
Hmm. Hmm.
I think these are some of the signs where you feel you have to take a break.
Yes, yes, yes. I mean, this is really helpful. So now, when these are for the doctors, anything that you will suggest for the family members of doctors who
Hmm.
are overworked, something for them that they should take care of them, what some points for them to take care of.
All right. For the family members of the doctor, it is very important to understand the nature of their work.
Hmm.
It is very common to be, anxious and impose your beliefs and your thoughts on the doctor, on your family member out of concern,
Correct.
right? But that is not going to help anybody. That is not going to help the one who is working. That is not going to help you who is sitting at home. So it is the first thing is you have to understand the nature of the work. And if at all a doctor is coming back home, it is very important to take all the precautionary measures. Be informed.
Hmm.
Be informed and be informed about the changing guidelines. If you're informed, you feel equipped, you feel powerful, and it also reduces your anxiety.
Hmm. Yes. Yes. Hmm. Yes.
Mm,
That's correctly said. So also, apart from this, any behavioral signs that you will suggest for the family members, for to take care
mm,
of them, any
mm,
change in behavior of the docters that they should take
mm.
care of, to let them know that you need to take care of themselves. Uh,
To the doctor,
yes, 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 correct. Any
uh,
behavioral signs that family members should notice
support.
for, yes, for the doctors, something like,
Okay. Mm.
if you can mention any.
All the red flag signs that I mentioned,
Okay.
we have to keep a
Fine.
tab on all these things.
Hmm.
And see, the work is so physically and mentally demanding. We cannot tell them you have to work for this time. You have to come back home at this time. Like I said, you cannot impose your thoughts on the other person, especially at times like this. Instead, they can offer support,
Correct.
empathize their work schedule, empathize whatever they are going through. I think this will help. And also, a little bit of gratitude also goes a long way.
Hmm. 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 Correct, correct, correct. So now, this is all about the doctors. At
Mm,
this time, there are also, general public also.
mm,
Everybody, in
mm,
fact, everybody is facing a bit of mental and emotional stress.
mm,
So some
mm,
very common points that you want to suggest for everybody
mm.
who is dealing with some kind of stress, but is not able to understand why is this happening with me. Sometimes you have some loved ones that you lose, you feel lost, but you just don't know how to react to that. You just don't know why am I react behaving this way. So any suggestions for the general public, what do you suggest to them?
Okay, it is very important to be mindful of what you're going through.
Okay. Hmm.
All right. If you're feeling sad, are you eating well? Are you sleeping well? And you can also be mindful of your behavior, mood changes, irritability, violence, or aggression. if there are any of these signs, I think they have to consult the mental health professional. Along with that, many people are locked inside. All right. It is very important for them to keep a routine, maintain a routine, wake up and start a day with some activity. Can be as mundane as, having a cup of coffee in the morning,
Hmm.
uh, listening to music. Start a day with an activity that, soothes you.
Hmm. Correct. Correct. This is
Uh,
very nice. Yes. Yes. So, and also for all those patients
mm,
who have mental illnesses and
mm,
are now dealing with this pandemic also,
mm.
and are into quarantine, what do you suggest for them as well as doctors who are handling them?
It is very important for them to continue their medications.
Hmm.
We have seen a surge in exacerbation of their of mental illnesses just because of non-compliance, because they were not able to get to the hospital, they were not able to get their medications.
Hmm.
The number of cases that has come with the exacerbation of mental illnesses and exacerbation of symptoms have been increasing. So it is very important to keep in touch with their doctor. If they cannot visit the doctor personally, they can uh, visit them virtually, and it is important to continue taking medications.
Hmm. 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 This is very very important. Thank you.
Mm,
You know, so let's understand how do you, with dealing all of this with all kinds of patients, how do you keep yourself positive and on track always?
I have since the beginning, even since the beginning of pandemic, I have always been working. So
Hmm.
that itself is helping me a lot. Also, I was in a bit of a reading slump, so I have been reading much more than I used to before. That
Hmm.
is really helping me.
That's very nice. So what I understand is, continuing a habit that you really like is what you want to
Yes,
suggest. This is really nice, something. So thank you so much for this, and this really insightful and really, some really simple tips to understand, to follow on an everyday basis, I believe can help everybody from doctors to the layman to actually get over this time and to understand what they can do to help themselves to stay positive and to stay healthy. So thank you so much, Dr. Kusum, for
my
this,
pleasure, Ayushi.
uh, for 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 such an insightful discussion. These are such small tips that you just forget on an everyday basis, to understand
Right.
what you should
Mm,
do. And actually, I should mention, just before the discussion, she mentioned to me that in your to-do list, you should actually write things that adds relaxes you every day. So
right.
yes, so I was telling her I make my to-do list, but I never write, that I need to take my afternoon nap for 5 minutes, because I normally skip that. So this is something that if you do and you tick that off, is something that helps you to feel good. And that is so amazing. This is something, thank you so much. I will definitely do this. And I'm sure, please do follow what Dr. Kusum has mentioned. I'm sure this will help you on an everyday basis. Also, if you have any signs that she mentioned, do take a professional help, which is very, very important, especially to doctors, because we know that we just run away from taking professional help. We just don't come into, we just, yeah, like, okay, we'll get better, it's nothing. But it's time that we need to take ourselves very seriously. This is something we should not ignore. And as Dr. Kusum mentioned, things, there are burnout cases happening. Please take care. And thanks a lot to Dr. Kusum. You have taken time for us to guide everybody here.
Most welcome. It's been an absolute pleasure, Dr. Ayushi.
Yes, thank you so much. Thank you so much, everyone, for joining us at this time. I'm sure this discussion would have been really helpful to you to understand how can you take care of yourself. Do share it with your friends and colleagues. This will help them to understand how simple tips, what are the small points they should take care on an everyday lifestyle to to maintain their emotional and mental health. Thank you so much. Also follow us on our Instagram as well as YouTube channels, where you can find all our videos that can help you in your career growth. Thank you so much, everyone. Thank you so much, Dr. Kusuma.
Thank you, Dr. Ayushi.
Yeah, bye.
Take care.
Yeah,
Bye.
bye.